Now we're going to move on to a pretty dangerous bacteria. I'm sure you've heard of it. Bacillus anthrax. Yeah, we're talking about that bioterrorism agent that was actually used against the US. Pretty crazy, huh? We're going to learn all about it. This is also known as the wool sorter's disease. I know, you're probably pretty jealous. What a great job sorting wool. But the key thing here is that sorting wool, so sheep and goats, are carriers for Bacillus anthracis, which is found in the soil. So it's a gram-positive rod that forms spores. And these spores are very, very resistant to environmental factors. So you'll find out that a lot of bacteria have spores, and the reason they do it is to survive in poor climates. So say we're in the winter, we can't make spores, we have to find houses and stay warm. Bacillus anthracis, if it's in a climate that or an environment it doesn't like or can't survive, it can form spores to keep itself alive to spread later. So human exposure is via animals or animal products, especially from goats. So stay away from the goats. So what are some locations that have goat exposure? So in a case, you might get a goat exposure at a petting zoo, in a farm, at a fair, things like that, and these can be triggers for Bacillus anthracis. Bioterrorism, remember the white powder that was sent in the mail? That was a major problem with Bacillus anthracis. It actually killed a couple people. And now we'll talk about the pathogenesis. So a key thing that Bacillus anthracis has that most other bacteria don't have is that it has a polypeptide capsule made of poly-D-glutamate. This is a very key feature here, and it's going to help prevent phagocytosis. So it lets the Bacillus anthracis survive in the body. It also has a toxin called the edema factor, which increases cyclic AMP, and that results in edema and fluid accumulation, similar to cholera. And you also have something called lethal factor, and I know it sounds dangerous, and this is the one that causes most of the problems in the patients. So it stimulates TNF-alpha release and IL-1, and it causes massive inflammation and necrosis. So let's first talk about cutaneous anthrax. So it's going to be transmitted by inoculation. So say you're petting a goat and you get some of it onto your skin. That's how you'll get this cutaneous anthrax. So how does it happen? It actually starts out as a painless papule with vesicles around it. So it looks kind of interesting. You have a papule with a bunch of fluid-filled blisters surrounding it, but then it gets bad. It ulcerates and has a black necrotic eschar in the center of it. Doesn't sound good, huh? And this still remains painless. So you have an ulcerated black necrotic eschar that is painless and can progress to sepsis and shock and even death. Check it out. See that really disgusting looking necrotic center? That's the ulceration going on, and it's completely painless, no pain at all. And that could actually be due to the nerve fibers being destroyed. It's also associated with severe painful lymphadenopathy and edema from the edema factor, and lymphadenopathy from the immune response. Treatment? Remember, treatment of the very strange small organisms that you don't ever hear about too often, always consider doxycycline. So if you have a weird intracellular organism or an organism that you don't hear about commonly, and you don't know what to pick, doxycycline is usually your best bet, especially with rickettsia, anaplasma, things like that. You can also give ciprofloxacin orally, and these can help treat the cutaneous anthrax. But now we get to pulmonary anthrax, where the spores are inhaled and germinate inside of your body. And that's what this whole bioterrorism thing was about, and why this is so dangerous. So what happens? It starts out with a long latent period, so you don't even realize any symptoms. You just have mild flu-like symptoms, maybe like a common cold, for a few weeks to months, and then you get this rapid worsening. You get high fever, blood in your lungs from the alveoli hemorrhaging, mediastinitis, meaning inflammation of your mediastinum and your mediastinal lymph nodes and your mediastinal structures, and even shock. And mediastinitis, a key feature of mediastinitis, is you get a widened mediastinum due to aortic widening. So an important thing to know is you have a widened mediastinum due to mediastinitis and inflammation of the aorta. So key feature, widened mediastinum. If you see widened mediastinum in a patient with an infection, probably after exposure to goats, always think about pulmonary anthrax. So diagnosis. How are we going to diagnose this? Chest X-ray or CT scan to see what's going on in the mediastinum and to know what's going on in the lungs in terms of the hemorrhage. You also want to culture the blood or respiratory secretions, because remember, anthrax is not a very common cause of disease, so we want to culture it to make sure this is actually what it is, and also we can send it to the public health department and let them know that anthrax is in the community. How are you going to treat this? So treatment is antitoxin. Alright, you obviously need antitoxin to get rid of this lethal factor, which is causing most of these symptoms, and also IV versions of the previous antibiotics. Remember, this is a very severe systemic condition. You need to give IV antibiotics. And for the cutaneous anthrax, if it spreads to sepsis and shock, the IV antibiotics are needed as well. Now we have another bacillus, but this isn't as severe as the previous Bacillus anthracis. This is called Bacillus Cereus, and is a very common cause of food poisoning. Alright, good thing to know, food poisoning with this bacteria. So it's gram-positive and also forms spores, so all the species of bacillus form spores to protect themselves against problems in the environment. So take a look, we got these gram-positive rods. Remember, they're blue-purple colored because they bind to crystal violet in the peptidoglycan, and they also have spores. But the spores aren't visible here. So you get reheated rice syndrome. Spores can survive recooking of rice. Remember, these spores are highly resistant to environmental factors, including heat. So if you have rice left out and reheated, that's going to be a perfect place for Bacillus cereus to grow. So it's common in buffets at Asian restaurants where the rice is left out, and if it's recooked, the spores won't die and they'll germinate inside of your body. So rice remains warm, allowing for activation and germination of spores and production of the enterotoxin. So the rice being warm at a buffet can cause germination of spores in the rice itself, or you can ingest the spore and the rice can germinate, or the spore can germinate inside of your body. So two possibilities. Spores that are in the rice can germinate because of it being warmed in the buffet itself, or you can ingest the spore and get germination inside your body. But either way, you get enterotoxin production, and that's going to affect your intestines. So you have an emetic type, which means you have predominant vomiting. That's seen with rice and pasta, so that's this whole reheated rice syndrome. You have nausea and vomiting as the primary symptoms and develop pretty rapidly. So just like Staph aureus, this develops very rapidly in terms of toxin. And it's very heat stable because it can survive the rice cooking. So the emetic type is heat stable. Diarrheal type, however, is seen with meat and vegetables, alright, usually undercooked. And what you'll see is you'll have watery, non-bloody diarrhea and cramps. So there's not much emesis here, it's mostly diarrhea, and this will be caused by the meat and vegetables by Bacillus cereus. And these things occur a little bit later, not as rapid onset, so they occur a little bit later, and they're heat labile. Alright, this is because they've been undercooked, you couldn't kill the bacteria and the toxin, and it's increased cyclic AMP in intestinal epithelial cells, leading to the problem. So diagnosis is clinical and treatment is supportive, give fluids, and have the patient rest, and usually this disease will resolve on its own.